We talked about who benefits from reference-based pricing. We've talked about pricing models SHP works with. How can employers get cost-effective health insurance coverage?
Well, health insurance plans are more than just premiums. It's more than just looking at the pricing and the bottom line. It's looking at the plan structure. What services does a carrier bring to the table besides deductible, coinsurance, maximum out of pocket? How do they treat preventative care? What programs do they have in place to help control costs down the road? Having that relationship with your insurance carrier where you work together to offer programs and services that reduce your employees' need for healthcare can definitely reduce costs over time. Today, I've got a case study of where we worked with one employer over the past 4 years to help reduce their premium on a per member per month basis by 7.2%. And so we're really excited to do this. This is not a story that we can always bring out to the market all the time, but this is one case where it did work with a good population. And they use tools like Care My Way, medication therapy management, and care management. And you can see over the last 3-year period that their usage of these services increased or at least stayed level or the same. We're going to talk a little bit more about those services like Care My Way and medication therapy management. So first up, we have medication therapy management. Medication therapy management is a 15-minute phone call that any member on your health plan can take advantage with Security Health Plan. Our pharmacist answers your employees' questions about prescriptions and over-the-counter drugs and medications. We try to help them find lower cost alternatives if appropriate. They make sure that our members are taking the medication and at the right dose at the right time. Our pharmacists will talk with their doctor as well and help correspond between the member and the doctor for any questions that they may have. We offer a 24-hour virtual care service. It's either a video chat or over the phone. Care My Way is 24/7, 7 days a week, available in all 50 states where our members can call up and get prescriptions over the phone for minor acute illnesses. This is for things like bronchitis, influenza, sinus infections, UTIs, minor acute items. This is not for your replacement for your preventative care. This is not a replacement for major acute episodes. It is for minor acute items. It keeps those minor conditions out of the urgent care, keeps them out of the emergency room where we know costs can be up to 3 times or if not more than what they would be at a Care My Way visit. Care management, this is our support team. Security Health Plan has their own nurses that work with our members that help them transition from one level of care to another. This could be based on disease. This could be based on a recent hospital stays. This could be based on complex situations. We work with them to make sure that they're getting the most out of their care and their relationship with their provider. They're really our navigator of how their health plan works with their provider to get the best recovery that they can with these certain conditions. On the right side of my screen, I have some examples of what this one school district saved by utilizing these programs. You can see in 2018, the total program savings was $5,324. On the previous screen, you saw the utilization was not very high. As we move closer to 2021, you can see how much that utilization has increased and the results in those savings that come through with those initializing those programs of $69,218. Savings alone through the use of Care My Way and medication therapy management were significant, let alone the care management. So you can see there in 2018, most of the savings there was related to Care My Way. In 2019, they added the medication therapy management where they've doubled their savings from 1 year to the next year. And then 2020, they had the additional savings with Care My Way, medication therapy management, and that care management. So as you can see, there's many ways that you can save by pairing up with your carrier to bring savings to your health plan that just isn't in plan design or in rates. Reference-based pricing is one of those methods that looks to pass on the cost to the member instead of trying to preventing reoccurrence and bringing alternative lower cost methods that have direct relationship to the healthy lifestyle of your member. We are trying to prevent items from long-term reoccurring. We're not looking to pass the dollar from one person, from the employer, over to the member. We're trying to do it through prevention and engagement with our members. So we hope that some of this reference-based pricing conversation that we've had on Mythbuster Monday has been valuable to you. And some concluding thoughts we have.
Reference-based pricing is a pricing structure used by insurers of all kinds. The biggest difference is Security Health Plan has contracts in place to support any reference-based pricing that we put in place with contracted providers, whereas non-contracted reference-based pricing is misleading and it claims to save employers and employees money when in reality the members or employees get caught in the middle and are balance billed the difference between the reference-based price and what is billed.